Hello, welcome to the webinar, Working with Stakeholders in Return to Work Processes, Employers' Perspectives, Challenges, and Opportunities. We're glad that you're here. My name is Mark White, and I'm the President and CEO of the Work Wellness and Disability Prevention Institute, formerly known as the Canadian Institute for the Relief of Pain and Disability. And I'll be moderating the webinar today. The webinar is made possible through the support of the Community Gaming Grant Program through the BC government, as well as through donations and memberships to our organization. While we are waiting for others to join us, I'll just go over a few technical points for the webinar. You should be able to hear the presentation through your computer speakers or through the conference call line if you dialed in. Please use the question box to submit any issues you may be experiencing or to ask any questions you have related to the presentation. We will collect questions submitted through the presentation, and following the presentation, we'll have a Q&A based on the questions that were submitted. Following the webinar, any questions not answered in the allotted time will be answered and distributed after the event. The presentation will be recorded and posted for free on our website within a week, along with the slides, and you will be emailed the direct links for all of these items once they're available. As I mentioned, my name is Mark, and I'll be moderating the webinar and Q&A. And our presenter today is Dr. Lynn Shaw. Lynn Shaw is a professor and director of the School of Occupational Therapy and the Assistant Dean of Citizenship in the Faculty of Health. Lynn is on the editorial board for the journal Work, and she researches and writes about issues related to work disparities in the contemporary world of work. And she uses an occupational science lens to deepen and explore strategies to enhance work opportunities. And now I'll hand it over to Lynn, and thrilled to have you join us for the webinar.
Thank you very much. Everyone can hear me, Mark?
Yes.
Okay, so I'll proceed. Thank you for the opportunity to share and disseminate issues that are important to me and I'm pretty passionate about. So I'll just jump right into the presentation. Those of you who don't know me, there's a photo there. You may or may not recognize me. When I was asked to consider doing a presentation, many things run through your head and about what is the best way to present some of the ideas that I've garnered through research and experience over the last 30 years. And it comes really down to why do we need to continue to focus on back to work issues and understand and enhance our processes. And that's what I'm going to begin to talk to you about a little today. Really, the issue of enabling people to participate equitably in the workplace is really a current global issue, and I'm going to explore that with you today. In my most recent book chapter called Working with Stakeholders, it emphasizes the need to focus on shared goals within the context of work and resumption of work. The research evidence also suggests that we have opportunities to learn from those practices that aren't going well and what we can do more of and what we need to become better at. And so today I'll share across those three areas some learnings that we can take away and hopefully begin to think about in our everyday world. The primary focus today will be really on some of the research that I've done on employers' perspectives and what are the opportunities for us to move forward and to continue to work with employers. I want to start with why the issue of work remains a global focus and where we are at on the world stage, because I think it's oftentimes a good idea to sort of step back and to think about that. And right now, decent work is an issue of focus in the global world today. And I think that this is something that sometimes we forget about, who we are and where we exist in the world and what we need to be doing. And I think when you think about work, the whole concept of work is becoming an occupational privilege in society versus something that everyone can enjoy the rights to do, to be able to participate in the marketplace. And really, this was the sort of the real sort of cornerstone initiative in 2015 of the ILO in terms of being able to focus on work. And this is just a little bit of background for those of you who aren't familiar with the International Labor Organization, sort of what their goal is in promoting jobs and protecting people. And in that area, they are devoted to promoting social justice, and they international recognize human and labor rights, pursuing its founding mission that social justice is essential to universal and lasting peace. And so in 2015, the focus on decent work began. And again, it's a step and a viewpoint to look at how we are doing. And they posited that their focus was really to continue to push the agenda of work being central to overall well-being. And that just isn't about individuals, but it's also to the communities in which they live. And the concept of decent work is, for those of you who want to pursue later, is nicely summed up in that PDF document that I've included here, and I'm not going to go into it. And if you actually are on your computer and you want to look at going into the ILO and decent work, you'll find there all kinds of resources that begin to shed light on the work that's going on in terms of decent work. Now, that's only 2 years ago that this started, and I'll come back to that in a minute. The other thing that I think that's important is that there are different organizations in society, such as occupational science, that really posits the importance of work being central to humans. And this is something that has been critical, that when you're involved in a valued social role, that also contributes to your overall health as well as your well-being. One of the things that I suggest is we're really far away from achieving the rights to work in the actual reality of the world today. And I have consistently, in the writings that I have done, advocated for a complex interdisciplinary approach, and that we use different perspectives such as occupational science to begin to add to the knowledge base to try and provide ways to open up a more inclusive space for people to participate in the labor market. And several of the concepts that I've been working with is along most recently is on work engagement and sustainability. So in taking stock of where we're at, in 2017, the ILO put out a report on where are we at with decent work. And some of the things are good. They said, you know, the global economic outlook looks great. There seems to be, though, some issues with regards to really pushing forward, you know, that people have access to decent work, and they're concerned about that. Despite the idea of the economic outlook being good down the road, there's really no focus that on the issues of increasing jobs or improving the quality of those who are working. And unfortunately, in the eyes of the ILO, the attention on the value of inclusion still seems to be lacking. And there's some important areas where you might want to further deeply look at what are those trends, and I've given you some information on where you can find that. But of importance at the bottom of this slide is that they point out that the areas that continue to be lacking in terms of addressing the issues of really decent work is those people who experience work disparities, women, persons with disabilities. The issue of precarious work has not really been addressed, and that it continues to be sort of where people struggle with lack of access to decent work is in the precarious work environment. So some of us have come from different professions that are on this call, and I belong to the occupational therapy profession. And recently there was a call from the World Federation of Occupational Therapy for us to stand up and to put pen to paper with regards to where do we see ourselves as occupational therapists in the world, and what's our stance and our standpoint on decent work. And I'm sharing just some of the information that's a part of our working document that we have not published yet, but some of the things that we have identified where we think we might be able to contribute, I have listed here. And those of you who are from other professions but share the love and passion about supporting people with regards to return to work might consider where your group would position itself with regards to the concept of decent work. So some of the things that we are beginning to identify is that we need to focus on people who are at work, and we should be concerned about their health and well-being, about them having safe places to work, and also mindful of what meaningful work and quality of the work environment is all about to people. It's different in different contexts, but again, it's an area that we think we can contribute to. I think that there's great concern across our nation right now for those who find themselves, like many of you, in the helping or the healthcare professions, and issues of burnout and stress in relationship to the complexity of the issues that we continue to face for those people who are at work. The other area we really need to begin to push a little further, and that is the whole issue of inclusion and really advocating for participation of work for all. And certainly I've pinpointed a few areas where we could focus on, and one of the ones I chose to focus on, which I'm going to present today, really is around employers and speaks to how we can push the agenda on inclusion of participation in work and address the needs of employers. So I will be sort of moving into providing you with some of the next steps. I guess some things that we are concerned about when we look at the work-related challenges for persons with acquired or temporary disabilities is in the area of, dealing with major life changes. Those people who, were the breadwinners in the family and no longer are. There's certainly the problem of stigma and discrimination across hiring practices. There's the whole issue of being able to return to the same workplace versus having to change employment when you acquire a disability. And I could go on, but there's many, many areas with regards to concern, mental health being another one of those. We also need to take a look at our own backyard. So sitting here in Dalhousie, a university in Atlantic Canada, doing this presentation, by taking stock of what's out there on the global agenda, we need to take a look in our own backyard and what are we doing in Canada as a country that's developed and has had lots of progression and movement with regards to all kinds of opportunities that we tried to put in place to promote the hiring of persons with disabilities. So it is really important, and Alan speaks to that. We really should be sharing our best practices and really moving forward so that we can overcome some of the issues that still continue to exist. So one of the things that I was asked to do a few years back was to look at return to work and write a book chapter on pulling together this notion of interprofessionalism, interdisciplinarity, transdisciplinarity approaches, and look at the fact that we have competing interests around multi-systems and multi-sectors when it comes to trying to promote people to either return to work or to actually participate in the workplace. So I have written a chapter on this, and I think I put it in a reference list at the end so that you can look it up a little further. In that chapter, I proposed a 5-step reflective process that might help us and our systems begin to think about that shared community of practice and how we could share interests and overcome some of the challenges And then how we go about tailoring for both individual and workplace the broader social contexts in which we can promote inclusion, diversity, and the rights to work. So I think it's important that, you know, this work was only recently made available to people, but I think it's important to share just briefly what I'm talking about in terms of what those 5 sort of actions and reflexive actions might be. So wherever you are, we need to continue to reflect on the situated nature of returning people to the workplace or resuming work or participating in work for the first time. And what I mean by that is we really need to look at the different contexts, and whether you're rural, whether you're urban, where the employment is. You need to understand the social systems as well and how they're really different within where you're at. And so you really have to understand where the local sort of culture and values are around return to work. So that's a sort of the first step. And in the chapter, I go through what are some questions that you can ask yourself around that to sort of better understand what's going on in your own communities. It extends to looking at reflecting on what the organizational priorities are in this context, and in the context of the push right now for collaborative practice, and what does that mean in your particular context. We've written several articles with colleagues in Canada around what are virtual teams, because the context in which we operate for many workplaces is virtual. They don't have access to hands-on services in their area, but we need to begin to think about how do we deliver collaborative practices. And so there's a series of questions to really just sort of take stock of where we're at. I think also, you know, part of, you know, the agenda for today is to excite people around how do we actually reflect on what are best practices and what are we doing that we could drop, but what do we need to do more of? And we need to do that collaboratively across stakeholders, because I think if we do that just ourselves as healthcare professionals, we're not really going to meet the needs of the employers and the people that we serve. I also think we need to think about what are the occupationally just goals for return to work. And this comes from a, you know, the social justice agenda, but also what's right in terms of, you know, the diversity and the value of people who can contribute and work, and how we go about those opportunities being made available to people. And I think that if we train people in our universities to perform work at a certain level, we should be connecting with employers so that we're fulfilling the need of employers and working with them alongside of those situations. So there's lots we can do there if we begin to think about what those are. And then, of course, we need to evaluate. What's surprising to me as a researcher, as I look at the most current literature, I see a drop-off actually in the sort of real positive thrust that we had from Canadian researchers in continuing to really push the agendas with regards to the more complex needs of workers in our country, and doing research that demonstrates the outcomes and the values and how we work in either multidisciplinary ways, or when we work in terms of individualized practices, how to make that happen. And so because I'm constantly doing literature searches on the topic, there's seemingly not as much research in the last 5 years being published on this topic. And that concerns me, because we need to continue to move forward, because the context of work is changing, and what we do in this country in terms of supporting people to become involved in work is also changing. Why did I think about the employer's perspective? Well, just so that you know, I've been exploring the perspectives of the persons who are returning to work, who have chronic pain for quite some time. We've done detailed reviews on their perspectives. We've also done detailed literature research and knowledge synthesis on the perspectives of health care professionals on the helping professions. And another part of that is to really look at the literature and what we know from the employer's point of view, because we need all of those perspectives together. So today I'm really just going to talk about the employer's perspectives and give you an overview of some research that I've completed and sort of what I think it means for us when we think about opportunities for persons with work disparities to be able to participate in work. So what we did is we started from the need to really understand their experiences, and we used the issue of hiring persons with disabilities because the literature is quite detailed with regards to this, and that was the area that we focused in on. So I'll share the knowledge with you, and then we'll come back to at the end of this presentation about this research and talk about sort of way forwards and opportunities. So this, some of the work that we did on this review is published, and it's looking at, the publication is examining macro and meso-level barriers to hiring persons with disabilities, and you can see the publication and you'll have the number there to be able to access that. So what did we do? Well, we began with a scoping review because we really wanted to explore the barriers in the hiring and retention processes from the perspectives of employers and to some extent persons with disabilities and what limits them, persons with disabilities, in finding and obtaining employment. So while we emphasize today the employer's perspectives, certainly we did capture in the same study some of the perspectives with persons with disabilities, and they're peppered throughout some of the slides that I have today to share with you. So the disabilities that we included were quite diverse across physical, mental, sensory, and cognitive areas. And you can see here that we, in the end, we ended up with 38 peer-reviewed articles, which primarily are studies, and then 19 documents from gray literature, and they were important in the study as well, and you'll see that reflected as we move forward. So some of the steps we took through this process was to manage a lot of our data in terms of screening processes with our team. And we used a lot of spreadsheets to code the information. We used Excel to run some descriptive stats. And then we had to use some very creative ways to synthesize some of the information to help it sort of come to life for the impact and what it means. So in response to gathering this information and reading all of the articles fully and then analyzing them, what became really clear to me is that employers in this literature are extremely candid. We have employers that have no bones about saying they have no plan or no interest in hiring persons with disabilities. And so that is a little bit disheartening to those of us who have a passion about wanting to sort of address this. But the reality is that's the truth with regards to the literature that we looked at. So the literature we looked at, it was 2007 to 2012. Certainly was, a combination of articles in terms of qualitative research and then some description and some outcome studies. And what was interesting is we also looked at whether, what are the commonalities or differences between the mid to large companies and then small companies, and sort of, some very interesting things is that the larger companies have very tailored needs for specific knowledge and for partnerships, and those small companies, they're the ones that don't have any resources, and they're going to rely on us into the future for information. So what did we do with the information? Well, once we categorized it, we organized them into themes, and we ended up with 8 predominant themes of barriers, and there were a total of 45 categories of barriers underneath. So these are the ones, and you can see them on your screen there. I think when I get into the details of them, it will really give us some insights on the depth of potentially what we need to do to, tap into new ways of thinking about how to support employers. So we took those 8 themes and we actually mapped them across the hiring process. So we organized the hiring processes into planning, and that means for employers who actually planned to hire someone, and then those who were hiring through the selection. There's a whole bunch of processes that you go through for those people who hire persons with disabilities, and then there's the issue of retention. So that was our first step. The second step, we detailed the barriers for a little bit more what I call specificity, if I can say that right. Anyways, for specifics, so that we could really get a clearer understanding. And then we actually tried to sort out how prominent across the literature are these barriers, and I'll talk a little bit about that when I show you an example. So, it's a researcher's prerogative to get, to use creative ways to sort of bring to life what the data is really saying to us. And so hopefully that's what I'll share with you today. So this is an example of how we were creative in sort of looking at mapping out, as you can see at the top, the planning, the selection processes were 4, and then looking at whether a job was offered, and then retention. So we took the categories of barrier themes, and then in there's a subset of what the numbers of subcategories were. And if you just look at the whole issue of planning, so across the literature that we looked at, this is an area of major concern. If you think about the majority of the barriers are in just getting started to hire persons with disabilities, and most people had many constraints as to why they were not even planning or how planning was difficult. And if you look across these different areas with regards to thinking about these categories of barriers, they're numerous. And attitudes being huge in terms of looking at, well, if we don't plan, we can't get people hired. And so if you then begin to look at, okay, where are the issues in terms of selection? And you begin to see that recruitment is a problem in terms of barriers that might sort of impede people hiring persons with disabilities. And then the biggest area is in decision making. And so, you have to sort of dig deeper into that to really understand further what is going on specifically with the employers. So let's take a look at the next slide. And I'll tell you a little bit about what we did because we wanted to understand that a little bit better. We wanted to look very specifically at, how important were certain areas, and then sort of how we could prioritize areas for change and where we might need to do more research. And so what we did is we created a scale of what I called barrier salience. And the qualifiers we used was the frequency with which the category might be cited in the literature, the frequency of the data that was extracted from both the evidence-based literature, so those are actual studies, and then gray literature, where people talk about what the barriers are, but this is our experiential information, and they write about it, but it may or may not be research-based, because I think both are important when we look at it. And then we can actually see whether there is evidence to support the gray literature as well. The third thing we looked at is what were the perspectives that informed the barrier across the documents. So, and I'll give you an example of that in a moment, but some of the studies interviewed employers and supervisors, and some of them had perspectives from persons with disabilities in them. Some of the research that was done we're asking other people, what do you think the barriers are that for employers to hire persons with disabilities? And then there are some governmental perspectives also that were addressed. So I'll show you that in a minute. And then there's the persistence of the barrier, and I wanted to look at this across time. So we looked at when did we start seeing this in the literature, and if you see something early in the literature and a document that suggests these are the barriers and these were the strategies to overcome it, were we seeing that this barrier was going away or not going away? So those, that were rated sort of fairly strong were the ones that were more frequent, were cited across the different kinds of literature, that they had multiple perspectives saying the same thing, and that it still exists. So those are the ones that we felt that were extremely challenging. So because we don't have time to review the detailed details of every single chart that we performed, I'm going to show you one. And this particular one is just taking the category of explicit discrimination. And so what we did with that is we went into every article that landed with regards to any of the categories. So these categories here are what are the subcategories within um, explicit discrimination. So then we mapped out each study. Each number is basically the number of the study that we looked at. And by the key at the bottom, the square boxes are employers, triangles are persons with disabilities, perspectives, whether it's an agency or a government perspective, or whether it was across all perspectives, we put a sunshine there. And then the other issue that we had here is we put down whether they're firms, and there were some disability categories that were predominant, so we actually mapped that in here as well. You can see we have hearing, vision, veterans, mental health, persons with epilepsy, etc. So when we did that, for every single one of those 8 barriers and then sub-barriers within each of those categories, we could map out very clearly where we think we have the major areas of concern with regards to strong barriers that indicate where we can possibly make a change. So if you see under decision making then in the hiring process, the issue of discrimination comes in quite strongly in different categories. And it comes in because supervisors and employers basically see that individuals with disabilities lack the fit with the work demands. So it's easy to basically say, no, we can't hire you. And if you look at the kinds of things going on here, we have evidence-based literature, we have some of the gray literature, and we have employers' perspectives quite strongly in here. We have some from the mental health, with the mental health perspectives. So what we're getting here is that this is a really based in something that we need to address for employers. We need to really get at what we can do about that, and we'll talk about that. Again, you can go down each one and to look at the fact that they're discriminating based on the type of disability and worker characteristics. That's what's evident in the literature. You can come down here and look at stereotyping, and you look at how that feeds into decision making, because they have an understanding that people with disabilities shouldn't be working, couldn't be working, and they wouldn't make good employees. So the general stereotyping came up in a lot of articles. The ability about when someone discloses or doesn't disclose can also be an issue with regards to the decision making at this particular point in time. And again, with our legislation, you would think that this doesn't happen, but it does, and it's in the literature, and it's very clear that that does occur. Issues with concern that people aren't safe, so therefore a person with a disability can't be safe, so therefore we won't hire them. Employers talked about the lack of access to a qualified pool of persons with disabilities, and so therefore they will decide not to hire them because they feel that there's not a large enough pool of people who may be qualified, so they don't want to hire. And also, if you look at this issue, there was one about the lack of fit in the workplace culture, and then certainly the lack of experience of just understanding how persons with disabilities can work. So this is an example then of how we use the literature to identify clearly that at the level of decision making, there's something that we could likely do. So the the next thing to think about then is what were all the ones that we felt that we could do something about. And so these are the 4 areas that came out quite strongly with regards to where can we make a difference with regards to support for employers, because these, not to say that all of the barriers aren't important, but you have to sort of tailor it down to what can you do and where can you go with that. So, you know, very strongly, I think that across the information that we were able to synthesize and then analyze is that this negative attitude about disability exists. And it still exists quite strongly from the literature, and all of this literature comes from mostly the developed countries in the world that have been, you know, examining the issues of hiring persons with disabilities. So it is a little bit concerning that it still continues to permeate and continues to shape whether or not people get ample opportunities, real opportunities to actually participate in mainstream employment. So these are the areas that we focused in on with regards to starting to think about what are opportunities and possibilities. We think that there's a need to understand really why these barriers at the macro and what I call the meso level continue to persist, and to try and counter these efforts, to counter this through promoting social security and inclusive employment practices, because that's really, you know, where we're failing on the global level, also with the issue of decent work. So just to sort of review in general what these 4 are. So these attitudinal barriers are, for the most part, related to the people just don't, they struggle as employers, or they preclude the planning processes for persons with disabilities. They also play a role in decision making in the selection. And we talked about the viewpoint that can a person with a disability be a productive worker. The area of lacking awareness of disability and management of the disability-related issues in hiring and retention. There's just a lot of unfamiliarity of how do you cope with somebody who discloses in an interview that they have a disability? How do you really tackle the issue at that time, and even formulating any thinking around accommodation and performance and future performance-related issues? And so I really found that these barriers really just the lack of confidence and really how to manage and address these issues. And I think that's an important thing that we can really deal with. I think the issue about understanding work performance, skill, and capacity is another area. So there were a lot of perceptions and beliefs that employers held about job qualifications and job performance and skill about persons with disabilities. And it's just really the lack of knowledge in being able to see how they might be able to fit in the workplace. They feel that they're really lacking the skills and capacities to be able to assess performance capacities when they're faced with a person with a disability. And that's keenly something that I think we can address. One of the other things that came up, I think, through this literature review and synthesis was really the lack of collaboration, the lack of policy monitoring where it does exist, the lack of access to education on websites and services on hiring pools and those types of things. So employers really need this. The literature stressed that, you know, there's a lack of integrated services that an employer can reach out to. They don't have established partnerships with regards to understanding what's available out there and how to work together, and that there's not a lot of equity in terms of some places are more well-equipped, have the knowledge, have lots of people, and can work with different groups. But it's certainly inequitable for people who have disabilities who may live in rural versus urban, or in high north or low south areas where access to employment is limited. So I think in terms of thinking about this as a big broader issue, I think there are things that we might be able to do. So when you're faced with actually coming up with those barriers that are quite salient, and you know you want to sort of tailor, where can we go to sort of really make an impact, and what can we do? So there are three things in three areas, and the first one is workplace capital. So from this study, we gleaned that employers really need information on the different types of performance issues for groups of persons who are similar in terms of function and performance, and to look at that. And I think that's really something that a lot of us could provide this type of knowledge and education for the workplace. They need to see concrete examples of the way work might be formed differently from what they understand it for an able-bodied person. And I think we also need information on how to go about evaluating the potential of a person with a disability to perform work. In the absence of, most workplaces don't have ready-made changes to work processes or easily implementation of any kind of accommodation for someone with a disability. So being able to do that is quite a feat when they don't really have the knowledge in the first place, but I think we can help with that. And I think they need information on how to go about addressing and exploring accommodation issues and interviews. And there are some good resources out there, but not all employers have access to them or are able to use them. And some of the thinking about changing sort of attitudes and knowledge might be to actually promote internships. And so they get to see how persons with disabilities could contribute to work in their workplace. And I think the other issue would be, and having looked at the hiring process, might be to look at what is the probationary period required to truly evaluate someone's performance. And I think, you know, keeping in mind that in order to improve workplace capital, we have to, keep behind there what's contributing to this so that we can offer opportunities to change. The second area, I think, in terms of support for employers is to really get at that whole issue of performance of skills of persons with disabilities and to be able to match them with work demands. So not looking at it as only the individual, but also to look at the skills that they have and how that could be addressed. I also think that certain workplaces may be more able to tap into the strengths and abilities of persons with disabilities in certain areas. And so having access to knowledge about the disability in and of itself may be very helpful to people, so that they understand what the disability does not mean, and might counter some of those attitudes that exist out there. And I also think they can then work towards understanding more the development and adequacy of skills that they may have, versus being so, taken aback by the concept of the disability being the barrier versus looking at the skills. I think tapping into the knowledge capital of persons with disabilities has been strongly overlooked, and it's something that we can help employers do more of. The standpoint of the person that has a disability can really offer the insights into the challenge of how you address performance and skill evaluation in the workplace. A lot of employers are concerned that in order to get through probationary periods and any issues that arise, where do you draw the line with regards to understanding, is it the disability that's the problem, or is it the skill level that's the problem? I also think that the standpoint of the persons with disabilities can also help with regards to thinking about ways and opportunities to develop employment skills, but also ways to come back into work. And I think that in order for an employer to really understand at the hiring level, they really need to establish a history of performance of what they're doing and other employers are doing, and what other employees who have disabilities can tell them with regards to how to go about this process. So oftentimes a lot of people want to look to the professionals to give them the insights, when in fact I think that we could bring the knowledge of the narratives and the long-term experiences of persons that have disabilities and how they've been able to meet the challenges and work with an employer to actually move forward. And I think that that would be very useful also to tap into those experiences of those persons with disabilities in the interview process, so that, you know, they can learn how to do this a little bit more effectively. And I think there's some really good resources out there. I just think that we need to perhaps move it towards how to enact those resources so that they make sense to employers. And the third and final area when we think of a way forward plan is really to develop, I think, from the broader community is, you know, a very strategic, organized, interorganizational and systems approach to developing knowledge around how we can do this better. I think knowledge exists out there, but we need access to real specialized knowledge in some instances, and I think we need to know where to get that. I think there needs to be a really good access for employers in terms of incentives to move towards inclusive practices, but also how to do it. And I think that there's an opportunity for us to sort of build that in. I think one of the biggest areas, though, is the real partnerships, and I'm talking about concerted and sustainable partnerships across the education and employment sector and across governments to really coordinate and to improve on our human and economic capacity for persons with disabilities to be able to be involved in mainstream employment and participate in the labor market. I think that, you know, the attempts of the ILO is really to improve Social Security in many countries, but by focusing on inclusion, this really should be helping us. And I think that more use of some of the international standards and guidelines with regards to this may be somewhat helpful, because all of them speak to the importance of partnering. What that looks like, though, in each area needs to be developed and become more equitable in order for us to reach a level of sustainable opportunities. So I'd just like to acknowledge that in putting that particular piece of research together, we did have some support from 2 different grants that I received. And, you know, research doesn't happen without, you know, support. And I was grateful to be able to have that and to work with a great team to dig into this particular area of concern in our society. So just in recapping, then if we look at sort of moving forward with regards to thinking about where we can support employers, these are 3 areas. And these would, you know, require us to get into what would a tactical plan look like in your particular area to be able to support that. And I think given what you've heard in the webinar today, and it's important for us to begin to think about how we move forward, not only on the concept and ideology of decent work, but also on how we can lead. How can we be more effective and attend to the ways to keep resumption of work in the forefront? And how can we help employers? And I really think that if we look at the 5 actions for reflection that I posited at the beginning and thinking about that, we may be able to assist in overcoming some of the constraints of different interests, you know, where it's difficult to cross boundaries and critical issues of who benefits and who loses if you hire somebody with the disability or you don't bring somebody back to work who has a disability. And we don't want to leave anybody behind. So I think some of these questions will be helpful as we go forward in having an open conversation and a dialogue about how we can be better I think that we can be better, and I think that there's opportunities for us to move forward. One of the things that I think about is that some workplaces are very advanced in their approaches to support hiring and to support people returning to work with certain injuries and conditions. And I think for some of us, in terms of thinking about this issue, is maybe we need to move to overcome some tensions at the higher levels of inclusions, and that can be where we focus in on how do we do this together, and that is to address some of these complex conditions that are going to be in the forefront of us to manage. So even if you take the issue of someone who is aging with chronic pain as an issue, and you take aging as an issue, that and all the natural things that come with aging in terms of hearing loss, vision loss, and now you're working and you have chronic pain, and all of those things together. Some of the cases that we're going to be dealing with regards to support for ongoing workers in the future, those conditions are very complex. And I think that that might be the starting point for us to build more and develop our inclusive communities of practice in this area, and to continue to push the agenda of decent work so that persons with disabilities can be part of employment and have the sort of all the benefits of well-being and contribution through work. And I think that we require our teams to develop the concept of collaboration and valuing the need for diversity and our knowledge so that we can move towards solutions to meet the needs of employers and supervisors and co-workers in those areas. And so I would like to thank all of you who have stuck with us and have shared in today's presentation, and I will be pleased to answer questions if you have them. So thank you very much for having me.
That was just fantastic, Lynn, and what a thoughtful and sort of systematic exploration of challenges and barriers and opportunities around issues related to return to work and employment for people with disabilities. Thank you very much. I thought it was I was delighted. If you're welcome to submit questions under the question area, and while we're waiting for questions to come in, I do have a couple of questions that I'd like to ask Lynn.
Sure.
One is did you see some differences between size of organization and
Yes.
could you talk a little bit about that?
Yeah, the one that's prominent perhaps in my mind speaks to what I ended up with a little bit towards the end of the presentation, and that is that those employers in the public sector who are large in size, who have resources where they have put people in place to address this issue in their workplaces, are much more advanced in their practices and approaches with regards to, enabling people opportunities in the workplace. That being said, they also identified the gap in the fact that there are not, those employment pools out there to access more people with different kinds of disabilities so that they can be even more inclusive. So the issue is that there's not sort of enough people out there for them to even bring more in if they wanted to, or to really understand, who are the best kinds of people out there with differences that can work in our environment. Because obviously, with different disabilities, there's certain areas where it's more complex to hire someone to be able to work in certain areas, but they would like to have more information on that. So even those that are doing really well are at that level, which I think was enlightening in the details. And I think that's important for us to know. And I think that perhaps, it said to me, I wondered if we're not doing enough to sort of have an interorganizational structure to be able to promote opportunities for people that otherwise could be working.
Thank you. Just a couple of things that came in, but they're more on my side of things.
Okay.
So one was, how will we be able to download content in the presentation? And we will be sending out a link for the recorded presentation and a PDF of the slide set, as well as links to resources. And they'll be sent to everyone who participated. And it takes about a week to post the webinar and to send out that link. So, a couple of people noted some audio problems, but the recording looks like it should be fine. So it was fine on my end, so that might have been just a local issue. Uh, while while we still are waiting for any other questions, I do have a couple of other things.
Sure.
And I was just going to put you on the spot, actually, and just say, have you been exploring the sort of pathways forward with Dalhousie University? I'm just sort of wondering whether, has there, I know that within some academic institutions, they've been trying to make some progress in this area.
Just be mindful, I've only been here a year, so so I've not, but I can tell you that at Dalhousie University, this is certainly on the radar, and it is across a variety of perspectives. So one of the things, I did not present on in here, is my passion about young people with disabilities who have been engaged in and then exit from post-secondary education. And so managing the transitions for young people with disabilities through universities and then into employment, as well as those people who get hired in relationship to disability. So there's a whole variety of areas when we think about that. And then there's the issue of managing work performance for those people who get disabilities and remain in the workplace, and how to make them as achieving their potential and performing well at work. So yes, at Dalhousie we have a whole area dedicated to addressing some of these issues, and we certainly have a task force, I believe, here that's looking at that. It's part of our inclusive strategies at the university, and certainly in hiring. It's on all of the job ads that go out to try and promote as much as possible. So I think that as a public institution, and a lot of the universities that exist, I did do a review of, and I'm not going to present it here, but of all of the universities and colleges in Canada with regards to, what exists out there for students moving through the system and then into employment. So that's a whole nother topic around looking at just that sector of employment. There are many other public sectors that are doing also very well in the Canadian context, but I really believe that if we don't keep it on the radar and we don't continue to monitor it and to give it its due, the whole concept of decent work will continue to be at issue, I think, in our society. This study was eye-opening to me with regards to looking at it from the perspective of employers about how hard it actually is if we don't resource for employers the things that they need to be able to bring people in and provide them with those opportunities to contribute and to be part of our society. So, it's eye-opening when you actually look at the literature and those employers that were willing to step up and to say things that we don't really want to hear. But it's their reality, and I think that we need to pay attention to that.
Um, Lynn, we have a question. It's more on a personal question, but I think it has an interesting area from an employer perspective. And this
Uh-huh.
was a person who has chronic pain, where the employer and has dizziness, so has sort and sh and the employee is interested in returning to work, but the employer is requiring full-time employment, and
Mhm.
that seems like that could be a barrier. Did
Mhm.
um, so it's a bit different than some of the topics of impl- um, of being employed or not being employed, but it's an issue of what systems are in place to support people with either intermittent or need greater flexibility. And
Mhm.
was that explored in the context of the study?
Um, Not specifically in this particular one per se, but of course I've done research into that in other areas, looking at that, and there are resources with regards to people with, intermittent capacities, and what can be done to support them in the workplace. And there was some great development of some business cases that looked at the value add for employers. Again, if you take it from the perspective of, looking at what employers are telling us in this, is that they're basically saying that we don't have the knowledge about how to do this, so we're not going to do it because we just don't know and understand, and they may not be in a position to deal with that. And so I think that if we look at that as a society and as a group of concern about this, then perhaps we need to work together to be able to promote, an understanding of what could be possible with regards to someone's individual situation and how to tailor that. Because sometimes people only see full-time as you got to be here from 8 to 4, and that's all there is to it. And oftentimes that 8 to 4 is not necessarily the time period where someone with a chronic pain-related situation can work, because meds don't kick in to a certain time, and then they are not productive to a certain time as well. So certainly the issues in terms of looking at those complex situations that have multiple concerns, there's no quick fix for that. But I think the issue is that what this speaks to from this presentation is that, we need to work with employers. We need to provide education, and we're not going to fix them all at once, but the more that we can provide an opportunity to say this is what's possible versus this is not possible, I think is where we need to go to sort of shape and change attitudes and to work with people. And it's worth trying because work is completely important.
Wonderful. Listen, we're going to end in a couple of minutes now. I just wanted to go over some closing points, but I'd like to really thank you again, Lynn. I was delighted to learn more about the research activities that you've been doing, and thank you for uh, sharing this work.